notice, especially to those 2, 3 attendees who have been able to join on such short notice. We had a problem with the daylight savings thing. Uh, so, uh, Good evening and good morning to those in America, or good afternoon to those in UK, maybe. Uh, so, I am Arunima and I'm the Deputy Director of GHQA India chapter. It is my privilege to be your host for this evening. So, basically, as you already know, today's webinar is brought to you by Global Health and Quality Alliance and Chitkara University. We are grateful to have with us a remarkable panel of experts from across the globe and equally grateful to each one of you who has joined us tonight. Uh, so before we begin, a few notes for everyone. Please use the Q&A feature to submit your questions. You can submit your questions in the chat box over here, and we will address after the presentations and discussions are over, or we'll try to uh, put them between the discussions as well. Okay, so a little introduction about GHQA. We are a global organization dedicated to advancing equitable, high quality healthcare through collaboration, education, and innovation. Uh, GHQA was founded in response to growing health disparities across the world. It brings together healthcare professionals, public health experts, researchers, and organizations to address systemic challenges and improve health systems worldwide. So, with a strong commitment to equity, innovation, and sustainability, GHQA focuses on critical global health issues, including emerging infectious diseases, non communicable diseases, maternal health, mental health, clean water access, antimicrobial resistance, etc. GHQA operates globally with regional chapters across Asia Pacific, uh, Africa, Europe, and beyond. So I would also like to introduce Chitkara University a bit because they have been helping us step foot into India and start our programs in India. So Chitkara University is one of India's leading private universities with campuses in Punjab and Himachal Pradesh. It is known for its strong emphasis on research, innovation, and industry relevant education. Chitkara University has consistently been recognized among the top universities in India for academic excellence and global partnership. The university's School of Health Sciences and Healthcare Management programs have been at the forefront of building the next generation of healthcare leaders in India, making this collaboration with GHQA a natural and meaningful one. So we are deeply grateful to Chitkara University for their partnership and support in bringing tonight's conversation to life. Now, I would like to introduce our panelists, and then I will hand over the mic to Dr. Parul, and then she can uh, uh, take on the conversation. Our first panelist is Dr. Parul Kodan. She's an MD, DM, MPH, and she works at Harlem Hospital and Columbia University, New York. Dr. Parul Kodan specializes in infectious diseases, tropical fevers, infections in immunosuppressed patients, and tuberculosis. She completed her DM in infectious diseases from AIIMS, New Delhi, and has served as faculty at AIIMS and consultant at ICMR. She holds an MPH from Yale University and has over 100 publications. She is currently pursuing a fellowship with NYC Health and Hospitals at Harlem Hospital and Columbia University. She is also our lead speaker and moderator for tonight's session. Our next panelist is Dr. Vishak C. Kerry. Dr. Vishak C. Kerry is an infectious diseases attending physician and assistant professor in the Division of Infectious Diseases at Wayne State University School of Medicine, Detroit, Michigan. He specializes in transplant and oncology related infections. Dr. Kerry completed his infectious diseases fellowship at Detroit Medical Center and Wayne State University after receiving advanced training at AIIMS. His academic work centers on CMV and immune reconstitution after transplantation. He is currently pursuing a PhD in immunology and microbiology at Wayne State University. He is also co-organizer of Global Infectious Diseases Grand Rounds, an international case-based educational collaborative connecting clinicians and trainees across multiple countries. Our third panelist is Dr. Ankit Mittal. Dr. Ankit Mittal is a consultant in infectious diseases at AIG Hospitals, Hyderabad. He completed his DM in infectious diseases from AIMS Delhi and holds a fellowship in transplant and oncology infectious diseases from UHN Toronto. Dr. Mittal will be speaking to us on India's preparedness for emerging infectious disease outbreaks. Our next panelist is Dr. Sakshi Khurana. She's an assistant professor of radiology at Columbia University Irving Medical Center and New York Presbyterian Hospital. She received her medical degree from Lady Hardinge Medical College, New Delhi, and pursued multiple fellowships in cardiothoracic imaging, abdominal imaging, and nuclear medicine at Columbia University. Dr. Khurana will be speaking to us on diagnostics in the context of emerging infectious diseases. Our next panelist is Dr. Amol Kodan. Dr. Kodan is an AI scientist at Exo Health, focused on advancing value-based care and public health through enterprise technology solutions and machine learning. His recent peer-reviewed work published in JMIR AI explores how artificial intelligence can serve as the digital backbone to accelerate the transition to value-based healthcare. Dr. Amol will discuss the role of AI in infectious disease management. And our final panelist is Dr. Aim. Dr. Aim is the chair and founder of the Global Health and Quality Alliance. He holds a Master of Public Health and brings extensive expertise in patient safety, clinical quality, and healthcare consulting. With experience at NYC Health and Hospitals, Mount Sinai Health System, and as Chief Medical Innovation Officer at Eldo Health, Dr. Aim will present on Outbreak Now, GHQA's platform, and will also offer our closing remarks tonight. So I hand over the mic to Dr. Parul now, and she will be moderating the session from now onwards.
Good morning, everyone. A special thank you to all the panelists who could make it despite all the troubles. Thank you, Vishak, for joining in despite your health. Thank you, Sakshi, for joining in despite the travel. Thank you, Ankit, for making the time work with the change in time. And thank you, everyone, for just joining in at such a short notice. So, because I think of the change in plan and the change in time, we don't have a lot of audience here. So, I had planned initially to start with a small game of outbreak control, but I don't think we have enough people. And maybe we can do another interactive session where we can play a game where we see the transmission of disease by transferring this. So getting on to the presentation, which will be a very, very basic introduction to what it is. This webinar is not targeted to finding the detailed information about these viruses. It's just a very basic introduction of those who don't know what the virus is. So can you see my screen at this time? Is the screen visible?
Yes, your screen is visible.
Thank you. So
maybe you can make it larger and
trying to do that. Okay. Can you hear me now? Is this audible, Ankit? I'm not able to move the slides further and enlarge it. I am sorry. Okay, I would move forward without wasting much time on this. So we're talking about the Hanta and the Ebola virus. And as we already discussed that I would be just covering the very basics.
Dr. Kodan, can you try to put the slides in slideshow modes? Maybe that
I'm
can.
trying to do that and it tried. I will stop sharing and start again.
Yes, please.
Or you can just send it to me and I can share from here.
Okay, so this way a webinar would be covering the very basics. So just trying to tell what the virus is, what this infection or this outbreak is. We're talking about two viruses, Ebola virus and hantaviruses. They're both very different diseases, very different epidemiology, very different infections. But what is common is that both of them are caused by viruses. There are many modes of transmission of infections, including bacteria, fungal, viruses, and here we are talking about viruses, with both of them being viruses of different families. They've both been associated with mortality, where Hunter has been associated with complications like pulmonary syndromes and hemorrhagic syndromes, where there can be bleeding, and Ebola also has an. Can you hear me now? Yeah. Classically, hantavirus has been associated with rodent exposure and Ebola has been associated with person-to-person exposures. Just to see an outlook, if you see under the electron microscope, this is how these viruses will look. So they are very different viruses. Ebola being a filoviridae, which looks like a long thread, and Hanta is a spherical virus. They're both zoonotic infections, which means they can be transferred from animals to humans. There are many infections which can be transmitted from animals to humans. Most commonly, we talk about rabies, in which a dog bite can transfer an infection to human. And so is the hantavirus, which can be transmitted by rodents. So rodents are the main source or the reservoir associated with hantavirus. And how does a virus spread from rats? It is usually by an airborne transmission through their aerolized excreta from the infected rodents. Not all rats cause it. In the last webinar I was attending yesterday, a lot of people have doubts and were asking if they see a mouse, are they at increased risk of hantavirus? So just to clarify that at outset, not all rats can cause it, only the infected rats in appropriate conditions can cause it. So the route of spread in hantavirus is typically rodent linked, while Ebola has been spread more through direct contact with blood or body fluids of infected people, like close contacts of caregivers, funeral practices, and close encounters is how Ebola normally spreads. Broadly speaking, hantavirus is divided into old viruses and the New World virus. The New World virus is the Andes orthohantavirus, which is the topic of discussion today. The old viruses can have often been associated with hemorrhagic fever with renal syndrome and are mostly found in the Asian part and Russia and farther east, while the Hunter pulmonary syndromes and the Hunter cardiopulmonary syndromes have been most associated with American subcontinent. So this is like a major differentiation, which is classically differentiated the old world virus and the new world virus. The New World virus is commonly causing a Hunter cardiopulmonary syndrome, and as I told, Europe and Asia has more historical predominance of outbreaks with hemorrhagic renal syndromes. I would skip the details of the fever with renal syndrome and move on to the cardiopulmonary syndrome, in which patient usually develops a prodromal phase of fever, chills, and myalgias, followed by a cardiopulmonary phase in which lung involvement, including pulmonary edema, can cause, requiring leading to severe respiratory distress and even mortality. So this is the virus which we are talking about, the Andes virus, which has been classically linked to Chile and Argentina. It is the only hantavirus uniquely which also have person-to-person transmission. Most viruses of hantaviruses are spread only by rodent exposure and have very limited data on person-to-person exposure. But this virus, which is the focus of our discussion today, is the Andes hantavirus, the family of which is initially the rodent host is a rice rat, but it can also transmit from one person to another person, while the original transmission is likely linked to an inhalation of aerolized infection from rodent secretions. Once we are suspecting, we send the blood sample, serum, or the tissue biopsy centers and do the very routine tests like serology, antigens, and the molecular tests like PCR for making a confirmatory diagnosis. Regarding treatments, just as we see in most viruses, there's no specific antivirals, but there's growing role of ribavirin, favipiravir, and some group of antiviral drugs which can have supportive data, but the research on that is ongoing and we still have a long way to go. But the most important part of management is the supportive management with careful fluid, electrolyte balance, hemodynamic monitoring. A patient with respiratory distress may need support of ventilator or ECMO. So the symptomatic management remains the cornerstones of treatment. There's ongoing work on vaccines, but we are not kind of diving into the research modes of that. Let me take you to the sailing through the outbreak. So how did this outbreak start? It was a big cruise which was all set for an expedition to South America, Antarctica, and had people from more than 20 countries going on this expedition. This all started around April 2026 when the voyage began. There were more than 150 passengers on the crew, and initially, after a few days of the crew, some of the passengers started developing fever, respiratory illness. However, there was a big alert on 11th April when the death was reported on board from respiratory failure. Later, CDC, WHO, everyone got into action and a cluster was found. And this is when they found out that human to human transmission is a concern in this outbreak. Andes virus is the virus which was isolated, and that is the only hantavirus known to spread between humans. The notifications have been spread out by disease outbreaks from WHO, CDC, and other international organizations, which are trying to quarantine people, isolate, causing international evacuations. As of today, the latest update I have is there are 11 total cases reported as per the website, with 2 possible cases. So the count of possible hantavirus in the entire world is 13 cases, with 3 deaths reported. And there have been a confirmation of multinational outbreak investigation ongoing for this. Now that we have a lot of audience from India, so I would like to say that as of now, from the best of my knowledge, there's absolutely no confirmed case of hantavirus in India. I did read few articles from Ahmedabad mentioning about it, but I could not find any confirmatory source confirming them. So as of now, the official figures do not show any confirmed case from India, and there are 13 cases all over the world. And this outbreak started from sailing in this voyage where the outbreak started. One of the possible theories is somebody from South American exposure with the rodent, where it's usually the reservoir, had the infection, and that's how it further spread, although the investigations are still undergoing. With the change in climate, change in environment, and a lot of stress on an environment, there's so many studies which are trying to link climate, One Health, animals, and how all these changes are ultimately increasing the risk of outbreaks, the food supply, the rodents, and the possible risk in future. And that is why it is very important to be prepared about it. Shifting gears from hantavirus to another important outbreak, which is Ebola. Things which I would like to mention in Ebola is with the start of the previous outbreak, because that's where we had so many deaths, and that's what gives us an information of how we possibly can handle. But before I start, I would like to pay a tribute to all the healthcare workers who kind of contributed so much in our learning to Ebola. Unfortunately, a lot of them lost their lives, and there were so many martyrs of medicine. With a total of 427 healthcare workers who were working in that environment, 236 died. And despite that, whenever there's a call of people of serving in this, there are a lot of applications. Like in the previous outbreak, there were 210 applications, with 150 who were interviewed and 110 who went for an outbreak control. And a big salute to all these heroes who continue to work despite the challenges and despite the high mortality rate, and try to bring the best out of it. So this is an Ebola is a systemic disease, and whenever there's an outbreak, we need to see if there's fever, weakness, headache, throat, myalgias, electrolyte disturbance, GI symptoms, any bleeding, any shock, or any organ failure, as in the course of Ebola. But these symptoms can be overlapping with so many infections. So when we talk most about them is when they have been diagnosed in an outbreak or have had a close contact with the person. So an appropriate epidemiology is very important, and that's what should trigger strict isolation and further monitoring. So if we find a person in a country with no previous history of Ebola, with fever, GI symptoms, and bleeding, should that trigger a red flag? Absolutely not for terms of getting panicked, but yes, for strict isolation and exploring the travel and the contact history. So the response pillars for an outbreak would be good surveillance, good contact tracing, communication risk being risk communication assessment and conveying the information, and the clinical readiness where an operational team is ready with isolation capacity, trained staff, PPE in trying to get ready for the work. What we learned from the previous outbreak was a good preparedness is very, very important. There was a very high mortality in 2015 outbreak in the initial of the curve. But as they went on to make these units, things became better. So they made this whole outbreak control camp in which there was a separate area to enter for the patient, a separate area to go out, a separate area to isolate low risk, high risk, a proper triaging area, burial facility, and everything, so as to kind of isolate a separate entry point and an exit point of those who recovered. These are some of the pictures from the actual outbreak camp shared by a friend who was a part of the camp. And what they told was a very touching story of this young lady, and that's I would of this young baby. So this young baby was diagnosed Ebola, and she got cured. And when there was a plan to bring her back to the community, there was a false rumor in the media which said that she's still positive and being sent to community, which was not true. And this doctor, kind of to try to prove it with repeat testing and everything, that she's recovered and she can come back to the society, she held her, kissed him in front of the entire audience, and that's kind of made faith to the people, and she could come back to the system. So although isolation is important, we should also be aware about rumors which can kind of make situation more difficult to tackle. To the best of evidence now, people who are recovered from Ebola do not have risk of spreading once they are recovered after an appropriate isolation period is over. So with these heroes in action, we need to be prepared for future, to be aware of such an outbreak if things happen. But as of now, the best strategy is to be aware about what all things we should be prepared of in case this happens. The best strategy for now would be isolation and good quarantine. As of 2026, the outbreak is ongoing in Africa, and that's the only country where it has been confirmed. It has been confirmed in Dominican Republic of Congo with a cross-border spread to Uganda. There's an estimate that it possibly started somewhere in early 2026 but was picked in May 2026, and that's when WHO declared it as a public health emergency, and the cases are rising in that small area. We have more than 900 suspected cases, more than 100 confirmed deaths, and there are 2 affected countries as of now. Although there's a very high surveillance going on there, this is the time when the CDC has come and said that the risk to US public as of now remains low. Our borders should be very active to look for any possible cases, but this is not a time to panic, but to be prepared. Just summarizing the last slide of Ebola and Aedes, these are the 2 viruses which we've been talking today. Ebola is the ongoing outbreak in Africa with more than 1,000 suspected cases, but more than 200 confirmed cases, with no confirmed case in USA, no confirmed case in India. And importance of knowing this emergency is to be aware about travels, isolation, quarantine, and testing at our airports, seaports, and all the borders. Coming to another virus, Hantavirus, which has been localized to the screws. There have been the travels from the screws which are being investigated. There are 11 confirmed cases across countries with 3 deaths, but all the cases till now have been trying and linked to the possible initial cruise, and that's how they're trying to build the contact tracing about it. Now, where do we go ahead with these outbreaks? In past and in future, we have learned a lot from the past, but where do we go in future? Potentially utilizing the role of AI and technology. It can help us in detection, surveillance, prediction, risk modeling, clinical decision making, research, drug and vaccine development. The whole plan for making a vaccine or a drug is a pipeline of many many years, and AI can accelerate this entire pathway by repurposing the existing drug and speeding up the design of drugs and vaccines, and enhancing the clinical trial efficiency. It is important to maintain appropriate health communication and communication engagement, and make our resources to the best utilizing the AI and technology in public health. And that's where I will stop and leave the panel to the other experts who have varied experiences. I will start with Dr. Vishak, and thank you again for coming here despite your illness, and thank you again. So I start from the fact that you have a PhD background as well. How do you see these viruses evolving through outbreak emergence, and what are the pandemic potentials? Are they the next COVID we should be afraid of?
Thank you, Dr. Parul, Kudan, for having me here. And I apologize for my hoarse voice, actually. But thank you, GHQA, also for having me here. I mean, that's a very interesting question that you posed regarding the potential of these viruses causing a pandemic from a virological background. So, if you kind of look at, and I want to answer this from a virology perspective, and if you look at these viruses which make a lot of headlines in the news, it is the RNA group of viruses, right? And it's not your DNA viruses like herpes simplex or CMV or EBV. These are not making headlines there. These are RNA viruses like COVID, influenza, respiratory viruses, and Ebola and Hanta, for instance, which are also RNA viruses which make noise here. So when we look at the virological aspect of this, it seems like these are viruses which use an RNA polymerase, basically, which lacks the proofreading capacity. And as a result, they develop a lot of mutations in themselves, and because of which there is a lot of quasi species that they can generate. And each of these quasi species are trying to survive in this environment and kind of propagate. And that particular quasi species, which picks up that mutation, which allows it to kind of break the barrier of species, like move from animals to humans, make them very well to spread between humans as well, and also kind of modulate host immune defenses and stuff like that. Those are the viruses that can actually cause problems. So if you look at specifically hantavirus is not known to cause human to human spread, but this Andes virus is one particular very specific hantavirus strain which is able to kind of spread human to human. So if you go back and see, it is probably that this Andes virus kind of came as a subspecies evolution, and it developed this capacity to spread human to human. And you're seeing this happen now because of the climate change, cruise exposures, and generally in environment, basically bringing humans closer to these viruses. So that's what is kind of happening. And if you look at Ebola in general, can it grow to a pandemic potential? Well, not currently, because of how lethal the virus is. Because for a virus to kind of propagate itself, it has to cause a disease in a person who can survive. It has high lethality. So probably if it mutates to a level where it can still cause a disease and keep it at a low fatality, it can still kind of produce problems in the future. So what I wanted to kind of say is, RNA viruses are a problem. They are known to cause havoc, and they will keep mutating to survive in this environment to come. So we have to be cautious about RNA viruses, is what I would say.
Thank you, Vishak. And you work in a big academic center, which is at the center of immunocompromised patients, transplants. So, how do you handle those? And where do you see US preparedness or your hospital preparedness for that matter at present?
Yeah, I mean, as you rightly mentioned, like currently the public health risk to US is low, is what they are kind of telling. But of course, the boundaries are leaky, right? Cases can come anywhere from any part of the world. At a national level, of course, a lot of things are being taken care of in terms of enhanced traveler screening, airport screening, particular quarantine centers, and stuff like that. But when it comes to an individual hospital level as well, like in many other countries as well, there will be specific dedicated centers which can actually take these cases in. But every hospital has to be kind of ready in case an eventuality happens and you get a case which you diagnose in the hospital. So accordingly, I would like to kind of think of this as like an identify, isolate, inform kind of a pathway, where you're kind of having where your ER and inpatient teams are kind of educated to kind of have a high index of suspicion to identify these cases, because they will come with overlapping symptoms, and an epidemiological history and a travel history is what is going to get them to understand if this is a particular case. So they have to be really prepared to have a high index of suspicion, and the moment they have an index of suspicion, they're not wasting time on kind of trying to get the diagnosis, but immediately isolate these patients. Andes coming in as community acquired pneumonia, don't think it is a community acquired pneumonia. Isolate if you have, if you think that it is happening. Ebola, again, overlapping symptoms. So immediately isolate, and you should have already isolation uh, infrastructure and training kind of built in. The third most important comes the inform pathway. Like you don't want anybody to be panicking in real time. So that is why you need to have a pathway where you have developed a communication system where you know whom to kind of call the moment you have a case that comes. The infection control should be activated, and your lab should be involved as well, and the state and public health department has to be involved as well, along with informing the CDC, at least from the US perspective. So that's what we have been told. And from our hospital perspective, as I told, of course, we are not a designated center to take in these cases. But then, when there was a 2014 Ebola outbreak, when we had a case that had come to Emory, we all got prepared, and accordingly, the infrastructure of our hospital also involved a particular section of the hospital which has these private rooms, private cordoned off stuff, which is already there. So we are kind of reviewing the policies that are already existing and trying to develop a communication chain which technically involves letting our chief know basically there is a particular case, and then he will handle it from that point. No matter whoever gets the call, whoever is the ID physician on call, it's the chief who gets informed immediately, and then a leadership will take it from there. But then again, sending the sample, do not rush to send the sample. We have been told to kind of communicate with CDC, and CDC will give us clear directions going forward. So it has to be like an identify, isolate, and an inform pathway, which has to be clearly kind of set in, is what I would say.
Thank you so much, Dr. Vishak. Uh, Thank you. And moving on from your academic center to another big academic center, Columbia, where multidisciplinary teams are trying to work it. Can I ask you, Dr. Sakshi, how the Department of Radiology can help us in this diagnosis and management, and how different teams can come in and make the management better?
Hi everyone. Thank you, Parul. Thank you for organizing this session. Radiology wise, I do not think there's anything very specific for Ebola. It just presents as the other viral infections. And on chest radiographs, when these patients get the chest radiographs done, initial stages it might be just normal, and you might not see any particular findings. And as the disease progresses, you can see interstitial prominence, interstitial edema. When these patients get fluid resuscitation, you could see features of pulmonary edema, and on CT, you would see more of airway centered ground glass and interstitial septal thickening. I think in the chronic stages, the way we are seeing now for post COVID sequelae, we might see airway like airway-centered fibrotic changes. Then in the abdomen, there could be features of fluid overload or pericholecystic edema, but nothing in particular which is very specific for Ebola. And then similarly for CNS, like they can present with cerebral edema in severe cases where there's parenchymal involvement and encephalitic changes. But otherwise, like imaging wise, it's more of a clinical presentation and diagnosis rather than anything particular from radiology.
Thank you, Dr. Sakshi. And now that's what makes it all the more challenging because we do not have a very specific diagnosis until we suspect it timely. So, can I jump on to Dr. Ankit, who has been a part of many outbreaks before? He has been, from what I know, I think he's been a part of Nipah, Zika, COVID, and a lot of outbreak management. So, how do you bring in your experience of uh, trying to manage the initial outbreak preparedness stage, and what would you suggest from Indian perspective, especially?
Right. I mean, first of all, let me clarify that a lot of what I'll be talking about is theoretical. Although there has been a little bit of first and second hand experience while discussing or Nipah virus cases and COVID, of course, everybody was involved. We were basically, like all of us, Dr. Kudan, Dr. Kerry, we were all a part of the team that were trying to, tackle with the COVID problem in India. But apart from that, my experience would be very limited. But what I know is in terms of preparedness, where India stands. Now, India has been somehow fortunate not to have had like big outbreaks. And in fact, there are two particular states in India. One is Kerala. Now, Kerala, which is a state in the southern part of the country, it's basically really good with its public health, monitoring systems, where for some reason, the physicians are really aware. They have a very strong referral system. They have a big network of infectious diseases physicians and epidemiologists. And what we have seen is that they've been able to really catch some of the outbreaks early. So Nipah is one of them. And very recently, there was this outbreak of Nipah in West Bengal, which again, one of our former colleagues, Dr. Shayantan Banerjee, was able to pick it up. So the key is to basically link all the clues. Nobody is going to announce that an outbreak is going to happen, right? It's all about clinical acumen, where routine causes have been ruled out. Whatever you see generally has been ruled out. For example, you have a viral hemorrhagic fever. You're worked up for everything that causes viral hemorrhagic fever in India, and you have some sort of epidemiological links, right? That is probably where the thinking should start. So outbreak preparedness, I believe, starts at individual level, where awareness about diseases has to be there, where people need to suspect, and then comes the role of organization level preparedness. For example, once you know there is an outbreak in DRC and Uganda with Ebola, and knowing that India has very good commercial relationships with Eastern Africa. So there would be a lot of traffic from Eastern Africa, Central Africa to India. So what India is currently doing is it is, setting up surveillance zones. Anybody who's traveling from these parts of the world, they are being screened. So they have to self-declare about their health. They have to, if they are symptomatic, they're kind of quarantined. Hospitals have been, designated hospitals have been put up in cities like Bangalore and even in Ahmedabad, so that is the kind of preparation that is going on. Now, with respect to testing, because it all boils down to whether you can test the sample or not. So it's not happening everywhere. Even with this Ebola outbreak, initially it was very difficult to detect because they were suspecting the Zaire strain, but it wasn't the Zaire strain, which they generally test. It turned out to be the Bundibugyo strain, and which took a lot of time to identify. Now, at the moment in India, the National Institute of Virology is probably performing the tests. Some of the patients have been tested who were suspected to have Ebola, but as of today, no confirmed cases have been reported in India. So, just to summarize, What I would say is that India is aware of the problem. The government is trying to set up system, but we must always remember that India is relatively a very large and a very populous country, where it is really easy for things to get missed. The only one big thing or one big potential, like Dr. Vishak was mentioning, that these viral infections by default do not have the tendency to become a large pandemic outbreak kind of a situation, right? So probably the virus itself will die down, and the surveillance measures or the strategies that are in place probably can further knock down the R naught for these viruses.
Thank you, Dr. Ankit. That was very useful. So as we move further, this is a question on the chat also. How can countries strengthen surveillance and early detections for the disease? Any specific advice for how the physicians or the government should be working right now?
See, the thing is, what I feel is it completely depends whether an outbreak is originating in your country or whether you're preventing an outbreak which has originated somewhere else, right? Now, the first situation is really difficult because it boils down to clinical acumen, suspecting a problem, and then having the ability to test it, right? So, if something is really new to your system, you may not have the infrastructure to actually test it, right? So that is the real problem. If some outbreak is originating in your country, it really poses a big problem. But if some outbreak has happened in another country, for example, we are talking about India trying to prevent Ebola outbreak, which has originated in DRC, Uganda, right? So there you know that there is a pathway from where the infection could come. You can screen people, you can test people, you can boost up your infrastructure around airports and seaports. So both of them have quite different strategies, in my opinion. It's much easier to try to contain something that has originated elsewhere, but it might be really difficult to, first of all, detect something that is originating in your country. And if it has a high R naught, so it could really spread very fast before you're even able to diagnose it.
Thank you, Dr. Ankit. That was very useful. Uh, as we move further, we are talking a lot about role of AI in all these public health. So, can I invite Dr. Amol to kind of give us an idea about um, how AI can help in public health surveillance and in public health in general?
When we talk about AI in public health, especially during outbreaks, I think the biggest advantage is speed. In an outbreak, timing can change everything. This is especially important for diseases like Ebola or Hantavirus because they can become serious quickly and may be harder to detect early. If health officials can detect a threat earlier, model how it may spread, and prepare resources before hospitals are overwhelmed, that can prevent infections and save lives. One of the strongest uses of AI during outbreaks is its ability to model how diseases may spread before situations become worse. By analyzing travel patterns, population movement, weather conditions, healthcare capacity, and population density, AI systems can simulate how an illness may move across different communities. For example, with Ebola, AI could help identify areas where population movement, healthcare access, and local transmission risk may increase spread. With hantavirus, AI could use environmental signals like rainfall, climate patterns, and rodent activity to estimate where risk may rise. These predictions help governments and hospitals prepare earlier by deciding where vaccines, medicines, staff, hospital beds, and medical supplies may be needed most. AI can also support early outbreak detection by analyzing large amounts of information much faster than traditional systems. It can review hospital visits, lab reports, pharmacy trends, climate data, and public health records to identify unusual patterns that may signal the beginning of an outbreak. For example, if emergency departments in several regions suddenly report increases in patients with similar symptoms, while pharmacies also show higher purchases of fever medication, AI systems can quickly connect these signals and alert public health agencies before the situation escalates. Together, outbreak modeling and early detection allow health officials to respond faster, prepare hospitals in advance, and reduce the risk of healthcare systems becoming overwhelmed. Another important role is inside hospitals and clinics, especially when the healthcare system is overwhelmed. During a large outbreak, doctors and nurses may be seeing many patients at the same time, and some patients may get worse very quickly. AI can act as an extra set of eyes by reviewing scans, lab results, and vital signs in the background. For example, AI can help analyze blood tests and scans to assist doctors in identifying patients who may be at a higher risk of complications or whose condition may be worsening. This can help the care team prioritize the patients who need urgent attention and track whether a patient's condition is progressing. AI can also act as an educator when the healthcare system is overwhelmed. During outbreaks, many people have questions about symptoms, testing, isolation, vaccines, and when to seek care. AI chatbots or digital health tools can give clear public health information, answer common questions, and guide people toward the right next step. This can reduce pressure on call centers, clinics, and emergency rooms while still helping the public get reliable information quickly. Beyond detection, hospital care, and public education, AI can also make a major difference in the scientific response to an outbreak. Once a new virus or disease is identified, the next challenge is understanding it quickly enough to develop treatments or vaccines. AI can support vaccine research by helping scientists analyze large amounts of biological data, identify possible vaccine targets, and speed up parts of the research process. This can help researchers respond more quickly when new diseases appear. So overall, AI can improve outbreak prevention and management by giving earlier warnings, helping model disease spread, supporting hospitals when they are overwhelmed, educating the public, accelerating vaccine research, and improving public health decision making. As outbreaks become more global and fast moving, AI will likely become an increasingly important tool in public health preparedness and response. Thank you.
Thank you, Amol. I know you were juggling with two meetings together, and I'm sorry because I just see that you shared a presentation to share along with it, which I did not realize before. I'm sorry about it. But we have a very interesting presentation coming up next, which will be telling us the real-time AI usage in public health. Dr. Amy is practically using it. He has this Outbreak Now app, which is tracking all this real time. And I pass him for the final word and for sharing his experiences of how AI is actually being used real time in public health.
Okay. Yeah, Arunima, can you share the screen for me, please?
Yeah, just a second. I'll
Okay.
do that.
Okay.
Uh, hmm. Uh, can I do one thing? Can I just share your PPT that you had already shared with me?
Yeah, just share the entire screen.
That one,
Yeah.
right?
Yeah.
Yeah, I'll do that. Okay.
Yeah, you're gonna share
Ju-
that as a
yeah,
web.
and you just let me
Just
know when to
yes,
change the
next.
slide.
Yes. Okay.
Yeah. Can you all see the PPT?
Yes. Can you expand it, please?
Yes. Just a second. I'll expand it.
Yes. Yeah.
Yes.
Okay. All right. Yeah. Thank you, Dr. Parul, Kodan, and uh, all panelists about this topic. And I really appreciate your time. And despite the difficulties that we had earlier today, yeah. So I would like just to jump into how technology, particularly artificial intelligence, can actually help us to detect. Yeah, can someone mute themselves so that we can, let's see, want to mute someone. We need to mute someone so that we can focus. Okay, thank you. So I don't know, can you mute yourself?
Send her to Emily, Dr. Stelter, but I don't think she'll. She's a high risk. No, she's here.
Okay, I'm trying to mute someone who's talking. Let's see. I'll try to mute someone. Okay, great. Yeah, so basically, I'll jump into how technology, particularly artificial intelligence and real-time surveillance, is a game changer and transforming the future of outbreak response. And as you know, we often think that outbreaks begins when hospitals start seeing patients or when governments issue alerts, but in reality, most of the time, outbreaks begin much earlier, sometimes days, weeks, or even months before they are officially recognized. And using antivirus and Ebola as examples, so I will show you how we are currently detecting yeah, outbreaks in real time and using some modern technology and yeah, so as you know, despite major advances in medicine and public health, one of our biggest challenges remains how we can detect, outbreak earlier before they become a real threat to the global health. And many outbreaks are still identified too late. And by the time cases are officially confirmed, usually transmission may already be what spreads, cause a lot of death. And so why does this happen? It's just because our systems are often fragmented. So that means there's not, a connection between data from hospitals, from labs, and even the community. So this usually delay, the response and has serious consequences. And because of this, we usually see high mortality rates and or other consequences, like economic disruption and all that. So basically, the problem is not necessarily the lack of data. We have data everywhere in hospitals, in laboratories, and everywhere. But the problem is most of data is just disconnected. They are underutilized and not analyzed quickly enough to identify, how we can detect outbreaks and how we can react and help with different communities. Can you go to next slide, please? Yeah, and in today's talk, we have two case studies. The first case is antivirus. As you know, antivirus is a zoonotic disease, as Dr. Parul mentioned, meaning it starts or it originates in animals. And in this case, rodents are, the subject animals. And the challenge with antivirus is that the earliest warning signs often occur outside traditional healthcare system. So, for instance, there's a change in rodent populations. There's a environmental shift. There's an increased rainfall. Uh, Early mild respiratory symptoms in communities usually are not identified. And so as you can see, um, on this screen here, this data, I got it from One Health, from the WHO. It just shows on how environmental data, animal health, human health, data is not well integrated. And because of that, there's no integration, right, across all these different disciplines and able to really help public health professionals and or government to identify these outbreaks and prevent the spreads or inform the population about these diseases. So can you go to next slide, please? And the second case study is Ebola. As you know, Dr. Parot did not mention, there are three kinds or three species related to Ebola virus. There's a Zaire Ebola virus that has been previously, discovered and has a very high mortality rate, which can reach up to 90%. There's a Sudan Ebola virus and Bundibugyo Ebola virus, with it's a new strain, and this new strain doesn't have a vaccine, and which means it's very important that we inform the population on how we can how they can protect themselves and how we can prevent the spread of this disease. So Ebola outbreaks usually or frequently begins in remote and underserved communities. And in this case, you've been heard a lot about the Democratic Republic of Congo, basically the eastern part of the Congo. So that part usually face a lot of challenges because of a weak surveillance, infrastructure. There's ongoing conflict, and because of that, there usually delayed laboratory confirmation because of all conflict, and healthcare professionals usually cannot, have access to those areas, and there's also limited communication system in those areas because of lack of internet connections and yeah, and all that. So these are the kind of challenges that like the eastern part of the Congo usually experience, and that usually leads to the spreads of outbreak, like Ebola outbreaks, and another challenge that usually cause these issues is the fact that the population can cannot screen it cannot be screened easily, especially when they cross borders, because people from the Congo can easily get to Uganda, can get easily to Rwanda, Sudan, and all over the places. Yeah, so basically, in outbreak response, days can mean the difference between containment and the catastrophe, and using the technology actually can help us to um, alert the population and alert the governments and or public health agencies on how to, prevent really the spread of this disease. Can you go to next slide, please? So the main issue here that we have, it's like we don't have a detection problem because that is there, everything is there, but we have a timing problem. And someone even in the chat asked how we can improve surveillance of these outbreaks. And the problem is, how can we detect these outbreaks in real time, earlier, days before even CDC or WHO declares them as outbreaks. So as I said, the issue is timing, and most public health systems are still designed to react after transmission has already started. And this is what we've been seeing for so many years. So this is just because we don't have real-time intelligence reports. Most data are not interconnected. So data from hospitals, from labs, from communities, and other systems, data is not interconnected. And sometimes communities just learn last and not first. That's the biggest problem. And sometimes, there's a low public awareness. People cannot change the behavior because if they're aware of what's going on, about an outbreak, an infectious disease, they can change their behavior. They can see a doctor. They can go to the hospitals, and so we usually detect outbreaks after transmission begins, and that's not how we can save lives. Next slide, please. Yes. So now here, I would like to introduce OutbreakNow. OutbreakNow is one of the platforms that I've personally designed. And the OutbreakNow is the global outbreak monitoring system, basically helping public health professionals and anyone, any user to track all these infectious diseases in real time, to see what's going on, to learn about these infectious diseases, how to protect themselves, how to protect the community, and even predicts where this outbreak gonna spread. And basically, it's a great tool that really change how public health professionals or public health agencies should react to all these different outbreak. So just to talk a little bit about this platform, it's an AI-powered real-time global surveillance platform and helping anyone to detect outbreaks before they become official. And just take the example at the GHQA. I usually, share some news before even these outbreaks become officials, and that's really great. So within this platform, basically, we built two kind of database, like for human health and veterinary One Health. So with human health, we integrated all infectious diseases out there, all kind of, like viral infections, bacterial, fungal, parasite infections. So we integrated all infections. We did the same in viral health. And so basically, we usually collect data from different sources. And we usually get data from, like get that from labs, from hospitals, and even users can just simply enter the symptoms, and then we use the AI to analyze those symptoms and come up with like like a syndrome, you know. And so basically, we use different data, even Google the data to to check the pattern of how people checks or search for some infectious disease online, and we use that basically to analyze the behavior and to see how we can inform the population about. So the idea of Outbreak Now is very similar to a weather forecast, but this is for infectious diseases. And I started working on this project a couple of years ago. I was in Nashville, Tennessee, at a hotel, watching TV, and in that area there's a tornado going on, and I was just watching TV. I was like, "What's a question came to my mind. Somebody like, what if there's an outbreak, an infectious disease outbreak in this area?" Old, like reporters make a lot of noise, as for like tornadoes or, floodings and all that. And then, I started developing the ideas to develop a kind of outbreak system that would be very similar to, weather channels. And after 2 years of hard work and research, we're able to develop Outbreak Now. Can you go to next slide, please? Yeah, so within this platform, basically, we integrate data from different sources, as I mentioned. So for your information, before every single outbreak or infectious disease outbreak become official, they usually start by local news. So basically, the local news gonna tell, what's going on in the communities. And after days or even weeks, local public health, departments gonna catch the news and do some investigations, and then CDC gonna jump in. And usually, it takes time, all right, for an outbreak to become, official. And so within this platform, basically, we scan every hour. We scan over 1,000 signals from all over the world, and we basically analyze all countries around the world. So at one point, I'm going to show you exactly how the platform works. And another way to get our data is through community reporting. So anyone, any user can use the application of the platform to report what's going on, and they can report the symptoms, syndrome, and anything. We also use Google data, Google Trends across, like Ebola, dengue, COVID, cholera, and other infectious diseases. And so basically, what we realize is we can detect infectious diseases like 7 to 14 days before they become officials, and which is really great, and it's a game changer. So as you can see, for labs and hospitals, that depends on a partnership that we have with a local agencies, because it's not really easy to get data. And like for the hospitals, most of the time, like the emergency room or urgent care, that kind of entry points, to the hospital. And that's where, it's much easier to collect data and to protect patients, information. We just grab, ICD-10 codes, and we process within the platform. And that's how we can easily, analyze data and present, like to local authorities and other. Next slide, please. Next slide. Okay. Yeah, so how like this platform basically works is really interesting. And so one way to protect the community is to empower the community, So what we do with this platform, the community has access to this platform. So basically, they can enter whatever data we process, and the community, they can receive location-based outbreak notifications, just like like weather channel. They can get exposure risk alerts. They can get prevention recommendations. They can, get emergency guidance from local health authorities. It's a really great tool that allows, like local authorities to interact with the communities. And this is extremely important, because outbreak response should not only involve, governments and hospital, but it should also involve community themselves. And when people receive timely information, they can change behavior earlier, they can seek care sooner, they can reduce exposure and protect vulnerable family members. And this basically transform public health communication from reactive to proactive. Next slide, please. Yeah, so basically, now we are just trying to imagine if, a system like OutbreakNow had been fully operational during earlier, outbreak. For instance, like for antivirus, we have the capability to collect environmental data. We can, check like rodent-related signals, and we can enter them within the platform. So the community, for instance, can report their symptoms, trends, and that can help us to analyze and inform those who could be at risk. For Ebola, what we can do is, we can analyze unusual symptoms. We can collect local news reports, and we can basically, understand the spread of this disease, and see how, it's just see like different reports on the map and within the platform. So the potential impact is really great, because like this platform basically, it really allows us to identify outbreak earlier before they become official. There will be like a faster containment, there will be reduced mortality and better resource allocation. So in outbreak response, time is one of the most valuable resources that we have. And as you can see here on this graph here, like outbreak can detect OutbreakNow can detect an outbreak or infectious disease as early as today, you know. But traditional system usually takes time, over 7 days to, understand what's going on, to do some investigations, and during that time, you know, what happens most of the time, there's a high mortality rate, and many people, uh, spread the disease, and that's a big issue. So with the outbreak now, 7 to 14 days early detection, there's a decrease of up to 70% peak case loads, and the response, right, to react to this, to how we can manage this infectious disease is like 3 times than, like traditional ways um, to react to any outbreak. Okay, next slide, please. Yeah, so this is basically the future of public health. As you know, there's so many presentations on Ebola, hantavirus, COVID, but um, most of the time, our community usually suffer a lot because there's lack of system that can really protect them. So basically, as for now, we are really entering a new era of public health, an era where AI can identify emerging threats earlier. Real-time system can connect hospitals, laboratories, communities, and all different data to process and analyze, and public health becomes, in this case, becomes predictive rather than reactive. And Outbreak now presents this shift. It's more than a dashboard or just a platform, but it's a global health intelligence infrastructure designed for the realities in today's world. And because the next pandemic is not a question of if, it's a question of when, and our responsibility as public health professionals is to ensure that when the next threat emerges, we at least ready for that. And yeah, so that's why we've been really looking for different partners, and I truly believe that this is going to be a game changer in the, you know, um, not only in near future, even today, in today's world. And so the next slide, I can just show you a little bit how Outbreaks works, but um, you can, you go to the previous slide, please. There's a link there. So you can check outbreaknow.org to just learn more about this infectious disease. And let's see if I can share my screen, and I'll show you just a little bit this platform. All right. So basically, this is the home page of.
I will stop sharing then.
Yes, please.
Or
Okay.
do you want me to show the
Y-
Outbreak
y-
Now page?
No, stop it. I'm going to share my screen.
Okay.
Yes. Thank you. All right. So can you see my screen? This is Outbreak Now. And so as you can see, I'm the person behind the development of this platform. And let's just jump to the map section. As you can see here, we basically collect data from all over the world, and this is a true digital epidemiology. And so we see different parts of the world and see like different reports, and this is in real time. So as I can, let me just zoom. Okay, I'll show you. Let me just go to like DRC here. You're gonna see like this is the eastern part of DRC, and you see we get different signals, we get different reports. You see, now it's even in Rwanda, Bukavu. So basically, everywhere here, we get the signal. This is in Kampala, and it's even spreading to Kenya. And so basically, that's how we really identified these infectious diseases. And talking about hantavirus, it's basically all over the United States here. Um, so you can zoom in and you basically, yeah, you see like in cancers, there's a hantavirus pulmonary syndrome there that has been reported. And so basically here we capture everything going on in real time. And so the good news about this is, as I mentioned, um, the community can also report, so they can enter whatever symptoms, syndrome, anything, diseases, and they can enter anything here, and we process, and so here just different news from all over the world that we're able to capture, and we built our system to capture like keywords, and we match that to our database, and that's how we can populate here. So if we build a partnership with a public health agencies, so it's much easier to integrate the data, to integrate hospital data, laboratory data, and that makes even this platform much better. And so as you can see here, I see like worldwide, Ebola virus has been, the most reported like over the last 7 days, or um, it's been like the most reported disease. There's a measles like here in the United States, and the antivirus, So these are different top diseases that can really alert, public health professionals to be proactive. And another great feature about this platform is that we can predict, as for now. And this prediction, basically, we refresh them like every hour. It's in real time. So for instance, now in Vietnam, this is what's going to happen. In Germany, I see like in the United States, the cholera is still there. No, the measles, I see cholera in 80. So it's a great tool, and it has a lot of potentials. And another great feature, as I mentioned, we track people's behavior on Google. So for instance, here I selected some, you know, I'm trying to monitor up to, I believe, have like 20 diseases here. And so by just clicking on Ebola here, let's see um, what I. So as I check just Ebola, it tells me that people in these countries are at high risk of, seeing an outbreak of this infectious disease. And so basically, if we are in relationship with people from Democratic Republic of the Congo, we can inform them about the potential of, Ebola. And that's true. This is basically what's happening right now. And as you can see, this is basically a game changer. And the platform itself is not at where we want, but this just like getting started. And we are currently basically looking for, more partners, and see how we can really, prevent, a future outbreak disease somewhere in the. So in summary, any outbreak is usually, a global public health threat. And I truly believe that digital outbreak surveillance can really help to protect communities. And as I mentioned, let's just focus a little bit about the Democratic Republic of the Congo, a country where I'm originally from. This country has been facing a lot of challenges, and because of ongoing conflict, especially in the eastern parts of the Congo where I showed you. And so the reason why there's an ongoing Ebola outbreak in that region is because of, as I mentioned, the conflict, and the public health professionals cannot, you know, get into those areas and help the populations there. And something else that usually happen is that people can easily cross the border without being checked. They can get into Uganda, into Sudan, into Rwanda. And another major issue that we are currently facing is the global funding gaps that prevent the development um, of vaccines. And as you know, like this third strain doesn't have any vaccine. They're still trying to develop, and it might take time. But before we get a real vaccine, what's going to happen is, we're going to have a very high mortality rate, and that's going to cause a lot of issues. Basically, it's any outbreak any outbreak disease is a true global public health threat. And public health authorities, governments, and should really take this into consideration and funds whatever institutions working on vaccines and protecting communities and all that. And I truly believe again that the digital outbreak surveillance is the game changer in in public health, because now we can analyze syndromic or like syndromes, and come up with recommendations, and just to help the population. And yeah, this is my conclusion. And if there's any question, let me check
Well, there are two questions from Sylvie. You have sort of answered those questions, but I think what she's trying to say, I'm sorry, I'm paraphrasing you, Sylvie, over here. In the given scenario, like right now, Outbreak Now is also not available everywhere, for example, right? Then
Mhm.
how can countries strengthen surveillance and early detection for these diseases? Specifically, for example, and I'm adding a little bit of my question here as well, that there are so many regions in the world, very remote regions, where technology has not reached properly. There are network issues. There are, you know, and in a lot of places, smartphones have also not reached. Then, have you seen any model that has been working, and or how can we reach those areas? And the next question is, what is the most effective public health strategy to prevent hantavirus and Ebola outbreaks?
Okay.
Yeah.
Yes. So,
And
answering about
I think what I asked, I think Emmanuel has, I think he has also asked a similar question, I think, and he's saying that how do we get this AI platform to apply it to our country, Zambia? Okay, so they are asking the other question. So these are the three questions we have, and I think you can answer.
yes,
I
yes.
think
So
mine has been answered. I got the
yeah, so
answer.
I
Okay,
So
answered
okay.
when you were
basically I
speaking,
answered that I
I picked
answered
the
that
answer.
already. Yes, I
Yeah,
answered
Yes,
that
yes, yes.
already because
yeah.
just if I can summarize again. So we live in today's world where everyone has access to to the internet connection. Most people in this world have access to the internet connection. How do I know that? People usually use WhatsApp from everywhere, you know, and so with the Outbreak Now is available all over the world. And so to make it very useful, we need to collaborate with local authorities, such as, in Zambia, as Emmanuel just asked the question. So basically, so if we work with a local agency in Zambia, we can basically integrate their data into our platform, and we're gonna process the data and really empower communities. So we have an app that is being currently developed, and so the population will be, gonna receive alerts when there's an issue. And we're not talking about the data, talking about data from laboratories, data from hospitals, emergency departments, urgent care, And any data that they can have, we can integrate within the platform and customize it specific to a location or a country or a region. And we can add a lot of feature to really help, um, prevent, the spread of any infectious disease and even, any outbreak there. Um, I don't know if I answered your question. And as for strategy, when it comes to technology, I truly believe that educating people is a great, yeah, is something really, really important. And as you can see here, for instance, within the outbreak now, the population, right, the community receive like weekly reports, and we can customize this so that community receive like a daily report. For instance, you see, like for this week, users of this platform received an education about Ebola, hantavirus, measles, and so many other diseases there. So they click there, they can get recommendation. You see the recommendation for general public: avoid this and that. Those who are not medical professionals, they can understand, what to do about Ebola. And medical professionals, they can read some recommendation. So it's a great tool. This is just to get started, but this can be customized specific for a region, and we can integrate the data, educate the population, and make sure that we collaborate with local authorities, health ministries, public health departments, and make this platform really, really useful. And so what you see here is just like 1/10 of what the platform is intended to do. And so that's why we are looking for partners to take over or buy the platform, or just to collaborate with us, and we can help them achieve whatever goal. And as I mentioned earlier, as of today, Outbreak Now is, I receive a lot of feedback from public health professionals, from, working from health ministries, different departments of health, and they told me that this is currently a game changer, and it's one of the most advanced global outbreak monitoring system. So um, it has a lot to offer, and this is how, we can really change the future on how we respond, to any outbreak, and prevent the spread of diseases, and protect our communities. Yeah.
If
I could
anybody has any
elaborate.
more questions, then they can ask. They can raise hands, and or they can unmute themselves and ask questions.
Mm, okay. Okay, Dr. Partab, I believe you heard me, but if you have any comments, if anyone has a comment, please jump in. And Dr. Parul, if you have something to say, you can also um, contribute
Thank you
whatever
very much for
before we
joining.
end
Thank you
this
really
session.
specifically because it was really, I mean, I think one of the key takeaway is how you can turn problem into solution. So he had an
Yeah.
idea, jumped into it, and is actively working in utilizing AI for outbreak control. So hats off to you for doing that, because I remember you talking about this, and now to see it into reality and shaping it out into such a useful tool is really really recommendable. I mean, I would appreciate that. And I think one of the leaving message we can all go by, whatever small we can do at our own self, learn more, spread the word, spread the awareness, and try to use the tools to the best of your ability to make something and innovate something new and make it useful for healthcare and for the world around.
Okay, so I'll close the webinar now. Before we close, I want to take a moment to invite each of you whosoever have joined us today. First of all, thank you for joining us. I would like to invite each of you to stay connected with GHQA. Follow us on our social media. visit us at the ghqa.org. I have provided the link in the chat. We also have a social media sort of a platform which is somewhat similar to LinkedIn and Facebook, which is called Live Health Plus, where people from all across the world can interact on different health issues, public health issues, and you can find other people uh, there. You can grow your networks over there. And rest, we are available on X, LinkedIn, and Instagram. So do join us. So for those in India, especially, they can contact me if your organization was working, if they're working in the sector of public health, or if your universities, they are working in the sector of public health or healthcare in general. We can talk about collaborating, and we can utilize such great tools that we have created at GHQA over here. And next, I really, really want to thank all of our panelists. Thank you for taking out time from your busy schedules. I know, especially because of the outbreaks that are going on in the world right now, you guys are really, really busy. Especially Dr. Parul Kodan, you were the one who assembled this group, this panel. Thank you for all the coordination and cooperation with us. And if anybody has anything else to say, you can connect us through our website. Our contact details are over there. And thank you. Good night and good evening, and have a good day from wherever you have joined us. Thank you so much.
Thanks
you very
very
much,
much. Yeah.
Taruna. Yeah,
Thank
thank
you
you.
for the meeting. That was very productive.
Thank you.
We have
Thank you, sir.
benefited for a lot.
Thank you.
Thank you.
Bye.
Bye.